This next test is a special test. It's called the Windlass test. Essentially, I'm just going to be pulling your toe in a little bit of extension and kind of trying to reproduce any of the pains. We can potentially do this test in 3 different positions. It's either sitting, standing bilaterally, or standing on 1 foot. Depending on the symptoms, we can progress. So if you have any pain with this, I want you to let me know, and then if you can, just kind of point to the pain if you have any. So I'm going to stabilize the foot. Any pain with that?
No.
Awesome. And then can you just stand up for me? So we do the same thing with you standing. And do the same thing. So this one might require a little bit more force. Any pain with that?
No.
Good. And I'm going to ask you to stand on that right leg. You can use this chair and hold on to it for balance if you'd like. And do the same thing. Any pain with that?
No.
Awesome. A positive test result of the Windlass test is calcaneal medial distal pain in the medial plantar foot. And negative test is not reproduction of any of the pain. This test is very good at specific for ruling in diagnosis of plantar fasciitis. This next manual technique that we're going to perform is the supine version of the posterior talocrural glide. So what we're going to do is we're going to take our stabilizing hand. We're going to get as close to the lateral medial malleolus as we can. We've got to creep up just to take care of the tendency for the knee to bend. And with our moving hand, we're going to find the anterior or medial part of the talus. It should just be distal to the lateral and medial malleolus. And from there, we're going to provide oscillations in the posterior anterior direction on the talus. And we're just going to provide the oscillations right there. The posterior talocrural glide is commonly used for improving dorsiflexion range of motion. And we can manipulate the skill by using the foot right on our body, creating more of a dorsiflexion area. From there, we can provide the same posterior to anterior direction on the talus. And for high grade mobilization, we can stick to the end ranges and oscillate from there. And for pain, we can perform a low grade manipulation. And by not going to the end range, we can just oscillate right in here. And to further manipulate the skill, we can do the same thing. We'll provide some eversion to the foot. And we can perform the low grade or high grade, depending on the irritability and pain situation of the patient, and promote overall pronation.